Hey guys, I want to provide a hopefully useful video for individuals, practitioners, people who are just starting to learn about PRI. I wanted to help understand the progressions that should and can take place within the context of your PRI program. So many times individuals take an initial course and then afterwards they might not get the full benefit of understanding wide array that the whole body can manifest when the whole assessment process takes place. Meaning, many times people take only the lower extremity course or myokin or pelvis restoration. Other times individuals take the postural course or the upper body course. In this case, they only get a small glimpse into one side or one facet of the whole entirety of how the body can be understood and taken into account. So this video hopefully will begin to explain how to better understand what pieces go where and how to understand the whole assessment process. So I also wanted to talk about what things can influence the assessment process or how things can manifest within the individual's body. So with this being said, I wanted to just start with this side of the column, right? So I have a couple other pieces here. I have here influences. So these are influences on the body. Generally speaking, we have the visual system, the vestibular system, the somatosensory system. We have the psychological side of things or behavior. We have chronic activity, also behavior, but more motor than anything. And then we also have orthopedics in the context of how does your body move? Is there any previous injuries? What are some things that are going on outside the context of movement? For example, there could be greater bone mass due to certain adaptations, for example. And that will certainly influence how the body will adapt. So what we're going to do is understand that 1 through 7 and beyond can have influences on how the body will adapt. It will have influences on how the body will present itself, because the assessment process is a time to evaluate. It's a time to observe and understand where the body is during this time. So with that being said, I have this ladder and then these bigger words here. So what we're looking at is, if I can explain this side first, I'll start at the bottom and then I'll go up. We have this posterior exterior chain, and then we have these three pieces. We have the left AIC, right BC, right TMCC, and then there's other iterations here. We have in a box neutral, and we'll talk about that in a second. And then we have steps beyond neutral. So I wanted to use some analogy to express the concept of going up a ladder in terms of progression. So many times within the assessment process, individuals may score a certain amount or in terms of range of motion, or they might score a certain quality. Right? They might have certain testing quality about the certain movements that we assess. So many times we might even see individuals that represent this. So this acronym, PEC, posterior exterior chain. At its simplest, what we can understand is this is the process of which an individual may present in a certain bilateral status. So posterior exterior, the back and outside musculature. And then with this being said, we'll start here as this is not the baseline because it's at the bottom, but this is the 0 point, meaning you can't go further than PEC. There are other iterations of PEC, and over here, if you can see this, it says patho-PEC. So technically, it's in the same realm, but then there's just a offshoot of this PEC pattern, meaning you've gone so far down this movement pattern that now you are stretching beyond your limit. So there's sometimes when you go into a pattern and you stretch beyond your limits, and then it becomes pathological in nature. Not an individual is like a pathological liar, but rather it's abnormal. It's outside the expected norms. So PEC, you can't get lower than a PEC. You can have an offshoot of a PEC, patho-PEC. This is where we're starting. From here, we can progress or improve, and we can get out of this and go up a step. And then this is where a lot of individuals might go, it's a little complicated because this encapsulates essentially 3 or 4 courses. Left AIC, right BC, right TMCC, which there would be other acronyms also, but at the end of the day, this is lower, this is upper, this is neck. What we're looking at is, this is the unilateral side of things that many individuals would kind of think of when it comes to PRI. So think of this as the bilateral side of things. This is the unilateral side of things, where there's a sort of a diagonal crossing down the chain. I have this all on one rung of the ladder because you can be left AIC, right BC, and right TMCC. Those acronyms and letters are all on the same rung. We can start to look at, okay, maybe we can make this left AIC pattern better, and that can become neutral, but then you might still be a right BC. You might still be a right TMCC, and you didn't get to neutral. So that's why that these are all on the same rung, because they all have the same level of influence. I did want to go over one last thing. These guys have their offshoots. We have a pathological left AIC pattern. Right BC, we have different iterations of the brachial chain pattern or BC pattern. Superior T4, there's some form of multi-directional instability, basically another form of pathological pushing through or stretching. And then in this right TMCC, we have right torsion, a left side bending. Patterns within the pattern, if that makes sense. So just to recap, this is all on the same rung because they are all influenced within one another, meaning many times a left AIC will eventually influence a right BC and vice versa. And then we can also say with some confidence, the right TMCC, which is the neck and above, can also influence the upper body, also influence the lower body. So that's why some individuals that you might work with, if you haven't taken an upper body or even a neck and above course, understanding that if you are trying to only influence the lower body, there might be stuff up the chain that might be awry. So that's why they all live in the same rung, because we need to identify lower, upper, and the neck and above. So once you hopefully identify that, improve how the individual moves, then you can go into this status of neutrality. And it's not just holding a neutral spine like in deadlifting or squatting, etc., but assessing this range of motion, if we can think of it as a quantitative or qualitative quality here, for neutrality of these areas. Lower body, what does that mean? There's certain assessments within the lower body assessments. There's certain neutrality or certain neutral ways to understand what neutrality is in the upper body and the neck. So once we get to this step, we are hopefully in the clear, but that doesn't mean we've gone beyond neutral. So neutral is like a platform. So that's why I really like this ladder analogy, because it's the next step. But that doesn't mean we are good to go, because once we have neutral, there are still things to do, because there are certain assessments that we still want to improve upon. This is a resting platform that we can now go beyond, which is why I have steps beyond neutral. So steps beyond neutral essentially would be other assessments that we can identify that will allow an individual to understand what integrative assessments will involve, using the whole body all at once instead of just a singular assessment. So many times individuals think neutrality or getting neutral means only getting neutral in the hips. There's neutral assessments for upper body, all the assessments in the whole body essentially. Getting these steps beyond neutral will allow an individual to understand and realize what it means to fully use their body. And now we can start to talk about, okay, now we can talk about performance-based things. Yes, many individuals within the sporting realm are in this PEC pattern. I fluctuate in and out of it myself, but if we can get to steps beyond neutral, we will have greater sensory awareness, we will have greater efficiency depending on your sport, we will have greater sequencing, and we will have a greater ability to have this performance-based aspect where you can now rest at a very easy level, get into the zone, as many individuals will call it. You'll have better flow, and this steps beyond neutral will now have greater ability to access speed and power while maintaining neutrality and going beyond neutrality. So with that being said, this hopefully should give some clarity to what the progression should look like for individuals based on where you are. Many times individuals, they can, depending on where you're at and what influences you, these influences can make somebody really tough in this area. They can also make this really tough. I've also seen a handful of individuals come in neutral, but still have some level of pain or dysfunction about their movement patterns. So influences can affect all these, but what we need to see is what is the most outstanding piece, and then assess that and apply some sort of treatment in that area, because then we can start to get better and, like the top rung says, go beyond.